Hello, my name is Evelyn Duran Fernandez. My topic is about Chlamydia Complication. Definition. Chlamydia is the most frequently reported sexually transmitted infection. It is caused by the bacterium Chlamydia trachomatis and has high rate of infection in sexually active adolescents. Genital chlamydia can be spread between partners through vaginal, oral, or anal sexual contact.
Chlamydia is a sexually transmissible infection, or STI, that is passed between partners during unprotected vaginal, anal, and oral sex. Many people with chlamydia do not have any symptoms, so they may not even know they have it. It is the most common bacterial STI worldwide, especially among people aged 15 to 29 years. Chlamydia commonly infects the urethra, but can also occur in the throat, anus, and even the eyes. As the body's immune system fights the STI, dead cells from the immune system and cells that die as a result of the infection are occasionally passed out of the body as a clear or milky discharge or pus. Other symptoms can be stinging pain or burning when urinating, or swollen and painful testes. If left untreated, chlamydia can continue further into the reproductive system, affecting the seminal vesicles, vas deferens, epididymis, and the testicles. Because the vas deferens and the seminal vesicles are so small, any scarring as a result of the infection can contribute to reduced sperm counts and infertility. Untreated chlamydia can also cause chronic epididymitis, which is persistent inflammation and pain in the testes that can be difficult to treat. Chlamydia and other STIs can be prevented by using condoms and water-based lubricant during sex, having regular sexual health checkups, and ensuring you or your health provider notify your sexual partners if you are diagnosed with an STI.
Application in nursing. The bacteria are found in sperm, semen, pre-ejaculatory fluids, and vaginal fluids. Chlamydia can infect the penis, vagina, cervix, anus, urethra, anus, and throat mouth. Most people with this infection do not have chlamydia symptoms and feel perfectly fine, so they may not even know they are infected.
Chlamydia is the commonest sexually transmitted infection in the UK. It's actually caused by a very small bacteria called Chlamydia trachomatis, and this is found in bodily fluids, so it's found in vaginal secretions or in the semen. Chlamydia is really common. I think there were 180,000 cases diagnosed last year, and the vast majority of those are in people under the age of 25. The dangers of having an untreated infection is that it could go on to cause complications. In women, for example, if you left it untreated, it could go on to cause pelvic inflammatory disease. And what that does is that actually affects the structure of the womb. So it can cause infertility, it can put you at risk of ectopic pregnancies, which are pregnancies that happen in the wrong place. Chlamydia is a sexually transmitted infection, which means that it's transmitted when there's an exchange of bodily fluids through sex. It can be transmitted through unprotected vaginal, anal, or oral sex, or even through sharing sex toys. The symptoms of chlamydia range from no symptoms at all to quite bad symptoms. In men, they might first of all experience pain on passing urine, very cloudy urine. They might experience discharge from the penis. They might experience pain in the testicles. In women, they might experience irregular bleeding, or again, lower tummy pain or vaginal discharge. Not everybody who has chlamydia has symptoms. In fact, probably 50% of women don't have any symptoms when they get chlamydia. Therefore, if you just look at your partner, you won't necessarily know whether or not they have chlamydia, and that's why testing is so important. The test for chlamydia is very simple and it's non-invasive. There are a couple of tests. First of all, a doctor or nurse might take a swab, or they may give you a swab to take yourself from the vagina. The other thing that you can do is just a simple urine sample, which doesn't involve any physical examination at all. The treatment for chlamydia is a course of pills, antibiotics, which are incredibly effective, and this is either given in a 3-day course of azithromycin or a 2-week course of doxycycline. To protect yourself against getting chlamydia, the best way to do that is to always use barrier contraception when having sex. That means that when having vaginal or anal or oral sex, whether that's homosexual or heterosexual, you should be trying to use condoms. If you are going to share sex toys, it's really important to wash them and use condoms on the sex toy as well.
Pros and cons. Pros. Chlamydia is easily cured with antibiotics. If left untreated, it can cause serious health problems in the future. This is why it is so important to get screening for sexually transmitted disease. Cons. But the consequences of chlamydia can be much more serious than the rise of getting more genital infection. If left untreated, it can cause serious damage to a woman's reproductive system, such as increasing in the chance of suffering from pelvic inflammatory disease, in addition, infertility or ectopic pregnancies.
What is it, and how does it spread?
Well, chlamydia is, as we explained earlier, is also a sexually transmitted disease. Is caused by Chlamydia trachomatis, and it's so common and so persistent because it's a silent disease. You could have it forever and don't know you have it. And the most likely is sometimes you get a clear discharge, vaginal discharge, but that so many it's so common for women to have discharges that they don't even notice that they have this. So nowadays, the recommendation is that anyone gets, before the age 24, gets a screen for a chlamydia infection. And it's very simple to be screened for a chlamydia infection. You could do it in urine, you could do it through a cervical swab. Why is this so important? Because the chlamydia is something that you pass from one partner to the next, especially in people who have multiple sexual partners. And chlamydia, even though it does not cause any particular severe infection, it causes a lot of issues with infertility later on in life. It affects the fallopian tubes and could predispose to ectopic pregnancy and other complications that are associated with it.
Yeah, I wanted to get to that too because you mentioned infertility, but there's a number of complications here with chlamydia I don't think people would immediately think about.
Right, exactly, especially because it's such a silent disease. It's going to cause pelvic inflammatory diseases and inflammation of the pelvic cavity. Infertility because it affects the fallopian tubes. The fallopian tube have a cilia, which is what allows the motility of that sperm to travel and the egg to travel and meet the sperm. And when that cilia gets affected somehow, it predisposes to ectopic pregnancy. What happens with ectopic pregnancy? Well, ectopic pregnancies are those pregnancies that occur outside the uterus that could rupture and has an increased risk of maternal mortality. As well as pregnancy complications, chlamydia infection could predispose to preterm labors, and newborn complications. Well, babies are born, they use antibiotic on the eyes, and the reason is to prevent chlamydia infections.
Can chlamydia, I guess, we're always talking about cures. Is this something that can be cured?
Yes, chlamydia is cured as opposed to any type of other things that we discussed, herpes or HIV. Chlamydia is easily cured with an antibiotic. Citromax covers quite easy. Now it's important that not only you get treated, but your partner gets treated because otherwise the infection comes back.
Issue athletes in Ecuador. According to the latest WHO data published in 2018, deaths caused by chlamydia in Ecuador have reached 1. The mortality rate by age is 0.01 per thousands of the population. Ecuador ranks 117th in the world. Check out other causes of death by clicking the links below or choosing the entire health profile.
Hello, I am Dr. Sudhindra Udbal. I am a dermatologist. I consult in my own clinic in Raga Skincare, JP 7th Place, Bangalore. Symptoms of chlamydia are variable. Many a times, both in males and females, there can be an asymptomatic infections with chlamydia, and these people can act as a reservoir of infection, which where they can spread it to the other partner, their sexual partners. Symptoms again depends on the extent of infection. In males, when there is an infection in the urethra, there might be a urethritis which would manifest with burning, micturition, discharge, slightly thin mucoid discharge coming from the urethra. Which is a usual symptom in men. In females, it can present with vaginal discharge, cervical discharge, upper genital tract. It can manifest with lower abdominal pain, high fevers, dyspareunia, which is the pain during the sexual intercourse. These are the usual symptoms which you see with chlamydia.
Conclusion. Anyone who is sexually active can get chlamydia infection. The more sexually partners a person has, the greater the risk of infection. Adolescents and young women who are sexually active are at increased risk of infection because the cervix has not fully formed and is more susceptible to infection, because chlamydia can be transmitted during oral or anal sex.
So you're curious about chlamydia? Well, good on you, my friend, because chlamydia is the most common STD that's completely curable. Here's what you need to know. Most STDs are either viral or bacterial in nature. Viral STDs usually can't be cured, while bacterial STDs usually can. So chlamydia is the bacterial sort. It's an infection that comes from the bacteria called Chlamydia trachomatis, or more accurately, Chlamydia trachomatis. It's a teensy tiny little bug that passes between people through their sexual fluids. Chlamydia can live in pre-cum, semen, and vaginal fluids. If those sexual fluids make contact with another person's mucous membranes, like their mouth, penis, vulva, or anus, well, that's how you can get chlamydia. Fortunately, it isn't spread through casual, everyday contact. So how do you avoid chlamydia? It's simple. 1. Know your partner's STD status before sexual contact. And 2, by protecting yourself with a condom. If you do catch chlamydia, most of the time it has no symptoms, so people don't even know they have it, which is why it spreads around so easily. But when there are symptoms, they look something like this: unusual discharge, spots of blood between periods, burning while you pee, genital swelling, and pain during sex, to name a few. Left to its own devices, chlamydia will start multiplying, wreaking havoc on your insides. It can make you more susceptible to contracting other STDs, internal scarring, and infertility. Sadly, some people don't find out they had an infection that went untreated until they decide to have a baby. Whether you want babies or not, the sooner you know you have an infection, the safer you'll be. And if you caught the bug, don't panic. You'll be prescribed an antibiotic to kill the bacteria. And it usually only takes a single dose to cure. But antibiotics are hard on your body, so it's best to keep yourself safe next time. Fortunately, getting tested regularly is quick, painless, and it keeps you safe. That's why we made the Safe app. Download the app and you can schedule a hassle-free STD test nearby that's covered by your insurance, or if you don't have insurance, at the lowest cost available out of pocket. And